Radon is a colorless, tasteless, odorless gas. It's a radioactive gas that comes from the ground. It gets trapped in buildings, and it puts us at risk of lung cancer. What happens is the thorium and the uranium that's in the ground decays once it gets into your body, and it decays right away. And it decays into two kinds of polonium. And polonium is what emits alpha particles. And it's those alpha particles that create immediate DNA damage in the cell. And then those cells are put at risk for cancer. They mutate and create cancer. Lung cancer is very prevalent in Kentucky. In fact, we lead the nation in both lung cancer incidence and mortality. We have a big job to do, and the reason that we lead the nation, most people think it's solely because we lead the nation in cigarette smoking, and that is in part true, but we also have very high rates of radon exposure. We live in a part of the country with a lot of caves. We have high karst, which is a combination of limestone and other soils and rocks that put us at risk of radon exposure. We also have very weak laws around secondhand smoke, so that restaurants, bars, workplaces still allow smoking in about 66% of the communities in our state. So we have what I call the triple crown of lung cancer, the triple whammy going on, because we have all of those three exposures putting our people at grave risk of lung cancer. In Kentucky, we're lucky that we have a prescription for radon program that's targeted directly at healthcare providers. It's a bag of goodies that has everything you need in your office to educate your patient's family and even children about radon. In the kit, there are materials, there are brochures for patients, there are brochures for healthcare providers. There's a coloring book for the children that you can put into the waiting room, and they can color along with their family and learn about radon in a very simple, easy way. And there's also a prescription pad for the healthcare provider to actually write a prescription for radon testing, and on the back of that pad is the phone number for the Kentucky Radon Program. Lung cancer is the single most preventable cancer. All we have to do really is help people quit smoking, rid environments of radon. After all, we can't rid radon, but we can get radon out of indoor environments. And the same with secondhand smoke. You know, simply ask people to step outside of your home, your car, and all workplaces to provide a healthy place for people to breathe clean air. We need more research. We need research from the bench to the bedside to the park bench. So we need research understanding what biomarkers could even be detected to figure out if somebody has been exposed to radon, because right now we have biomarkers to tell us whether somebody is smoking or somebody has been exposed to secondhand smoke, cotinine, for example, in the urine or the blood or the hair, but we don't have any type of test like that to detect radon exposure. So we need more research on the bench side. We also need research on the clinical side to understand how to detect radon-induced lung cancer, how to treat it better, how to treat it, and then how to promote survival in those patients. And also how to even train and get to the healthcare providers so that they talk to people about testing and mitigating for radon. On the population science side, we need to understand how to convince people, how to motivate people to test and fix their home for radon. We need research to understand whether a tax credit might work, much like we do a tax credit for energy, fixing your home for, to make your home more energy efficient, much like we do for solar panels, for example. That might be a really effective way to get people to test and fix their homes for radon. So we have a lot of research that we need on radon exposure.